So I remember all those years ago at dental school being taught most of the time when there isn't enough room for the teeth, that a lot of cases teeth would need to be removed. In particular, all four premolars was a fairly regular sort of case where they take the premolars out and then drag the other teeth back into that space. What's your experience of this? I mean, what's sort of the percentage of how many cases you might need to take teeth out on and that kind of thing?
Well, my personal experience of this goes way back to when I was 11, when I was the victim of having 4 teeth out. That was the standard approach back then. I would also say that when I graduated as a specialist orthodontist, that's exactly the way I thought. And in my first 3-4 years of practice, probably 80 to 85% of my patients required, or I thought required, the removal of 4 bicuspid teeth or premolar teeth. If you look at the statistics in my practice now, possibly less than 5% of patients require extractions. And the patients who require extractions are normally those who either have come to my practice too late in the day and I haven't been able to do the functional jaw orthopedics, or certain profiles, particularly Chinese, Asian type profiles, where they have large teeth and their teeth are too far forward. So they actually do benefit in some cases by extracting teeth, because when you bring the teeth back, it balances the face. But I think that's the minority rather than what used to be the norm.
So we're not saying you would never need to remove teeth. We're just saying that it's a lot more rare the need to remove teeth than perhaps we used to think.
Exactly, and it's better to make the decision whether teeth need to be removed after you've done the functional jaw orthopedics. So it's better to build a house once you know the foundations are stable. Whereas if you only have one approach in mind, and that is, let's see how the jaw grows naturally, and if there's no room, we're going to have to take teeth out, then of course you're going to be guided more towards the traditional extraction approach, the way I was 20 years ago.
Yeah.